Many women around this world are affected by a hormonal disorder that is possibly easy to recognize within a few women, and others it's hardly possible to recognize it, which makes it impossible for anybody to know that they are carrying a hormonal disorder that could be treated or that could be identified by a physician. The hormonal disorder that I am speaking about affects 5 to 10% of women among the world, and it is called polycystic ovarian syndrome. Polycystic ovarian syndrome consists of, well, your ovaries having cysts, but the common symptoms is to your menstrual cycle lasting too long, having irregular menstrual cycles. So as someone who has polycystic ovarian syndrome, I can say that my first symptom was having irregular periods after a few years. So by age 20, 19 to 20, I realized that I was having irregular periods. So I went from bleeding a lot to bleeding nothing at all. I didn't get my period um from maybe 3 months to 6 months to completely disappearing. Or I would lightly have, like, I would have a light period, but I wouldn't even consider a period because there was no blood. I was used to, excessive bleeding. So, missing periods, irregular periods, or light bleeding can be a very common symptom for PCOS. Another common symptom would be excessive body hair. So, when I refer to excessive body hair, I don't only talk about, oh, hairs in your armpits, hairs, in your legs. It's normal to have body hair. It's part of growing, it's part of, your body expanding, developing, it comes with it. But when I say excessive body hair, you can visually see too much body hair where it shouldn't be. So many women like very self-conscious about is the back. So the back consists of excessive hair. Like, yeah, we have peach fuzz. Yeah, our body grows hair. But when I say excessive hair, it's excessive thick grown hair. Like you can, women really do get self-conscious because of it. Another thing that also they get self-conscious of is the excessive weight gain. So it's on older women because this does affect ages 15 to 44. The weight gain makes it impossible as well, along with the hormonal imbalances. For those who try to conceive, it makes them infertile. So having PCOS is almost a slightly chance that you are infertile or you can be infertile, but I know there's many treatments to make yourself fertile and it's not impossible. PCOS and trying to conceive is hard. It is hard. And I've heard many stories about people trying to conceive while having PCOS and they find it so hard. But then at the end of the day, they find the light and they say, you know what, my doctor recommended this and I am now pregnant and I am now having my third child. And PCOS is inherited within your family because I have a sister who has PCOS as long with me, but she had it a little bit, higher than I did. So since we are on a topic of the symptoms of PCOS, I want to give the example of my sister. My sister has PCOS, but she is now having her second child. And like I said, I don't want to say infertility is super hard or super difficult or impossible. It's just a lot of treatment goes along with it, but it's not something that is a never thing. My sister did suffer from the facial hair. Like I said, PCOS, a symptom is facial hair, and her facial hair was in the areas of the chin. So she would grow excessive, thick, almost beard-like hair within her chin. And she was always self-conscious and she did laser and she did this and she did that and she did multiple things. but she decided not to treat it. She decided not to mention it to her doctor. She decided not to get help for it. And that was an issue that everybody wanted to like consider, you're doing all these things, but you're not helping from within, from your body, because this is something that is controlled from within, not from the outside, even though it is something that people struggle with. They become self-conscious, and it's completely normal to be self-conscious about it. So the ways my sister could have avoided that was, speaking to her doctor about it. She never decided to her doctor about it. She rarely even went to the doctor. So PCOS can be diagnosed by multiple ways. If you bring up the attention to the right doctor for it, because there are multiple ways to diagnose it. And that includes your pelvic exams, that includes physical exams, that includes ultrasounds and blood test ultrasound. And the ultrasound demonstrates how it looks. And I will be showing that right now. So this is how the ovary looks when you have PCOS. So you see these black spots right here, those are cysts, and this is the right ovary of the woman that is being taken the ultrasound. It, like I said, it's quite visible to see that you have PCOS, but like I said, you have to look within. It's not, so then another thing is when you do the ultrasounds and you do all of that, you want to actually focus on treating it. So what I was given was diabetes medication. So with diabetes medication, they do give you a big one because you do become, you know, I want to say dependent on them. They do ask you to take one in the morning and one at night, and it's, you have to take it daily. And the pill looks something like this, at least mine, which is metamorphin. So this is the pill that I was given. I was told to take one at morning, one at night. So PCOS is not only on your ovaries, but like I said, it can cause other reactions within your body. So it can give you type 2 diabetes, and that's why, especially if you are overweight or you are considered what the doctors say obese, there is a higher chance that you can have if you have PCOS or you're experiencing symptoms of PCOS, there's a higher chance of you also obtaining type 2 diabetes. Along with type 2 diabetes, it causes high blood pressure. You can have multiple complications along with it. That's why it's important to follow some of the treatments, or at least give them a try to see how your body reacts to it, because it can also cause heart problems and, like I said, infertility. And if there's ways you can avoid that, it's really highly recommended to do it. The reason for PCOS, there isn't really a reason as to why it occurs, but it is known that it is something that is inherited, especially if it's already among the family, along the women in your family. So as for me, I don't know where I got it from. My mom doesn't have PCOS, but my sister and I had PCOS. So it's something that's just, if somebody has in your family, there's a high chance that you can have it too. So it is recommended to, if you are experiencing any of these symptoms, if you are taking knowledge of any of these symptoms, contact your health provider. And, especially if you have any questions, anything like that, once you contact your health provider, write down the questions, keep them in mind, keep them, present. Make sure if you can't remember yourself the questions, make sure you mention it to somebody and take them with you to your doctor's appointment so they can actually remind you, hey, you had this question about this thing. If the doctor recommends you any test, any medication, any treatment, take it into consideration. Keep in mind that your doctors are only trying to help you. The right doctor will do anything to try to help you. And if they're trying to help you, it's important to take into consideration. It is your health, and the main goal is to be healthy and to be okay, and to live your best life. So if you are experiencing any of the symptoms, please let your doctor know. Please communicate it to anybody around you. Have encourage yourself to actually open up about it. It's not something to be afraid of. It's not something to run away of. If anything, it's something to work on. It's something that, um, I don't know, it's just something that should be normalized to take into consideration. Health is very important, and maintaining it is also very important. So that was my presentation on PCOS. My name is Diana Ramirez, and thank you for listening.